Hi, I'm Tracy Nguyen, and I'm going to talk about maxillary skeletal expansion, which is MSE. MSE is also a form of MARPE, which is micro-implant assisted rapid palatal expansion. So let's talk a little bit about expanders. There are tooth-borne expanders and there's bone-borne expanders. Examples of tooth-borne expanders are bonded expanders where they're cemented onto the teeth. There's a nice little platform that covers the teeth. Another expander is a light wire expander. These are like your ALF appliances, your Crozats. Then there's a removable expander, which is like your Schwartz. There's a Hyrax that's bonded to the teeth, and then there are even self expanders. So you just put them in and there's a spring in there and then it expands. Now for adults, we typically we want something that is attached to the bone. The reason behind that is because pretty much after the age of 15, that median suture is really tight, and expansion that's anchored to the teeth is mostly dental expansion. It's not bony expansion anymore. And before we had micro implants, we had to do all of the expansion surgically. Now with mini implants, we can actually place tiny little mini implant screws into the bone and pop open the suture. So hence the birth of micro-assisted rapid palatal expansion, MARPE. And MSE is a brand of MARPE. And there's always this confusion like, oh, it's a MARPE, it's an MSE. MSE and MARPE are the same thing. It's kind of like Apple is a brand of a laptop. And so Apple is to MSE as a laptop is to MARPE. You got it? Okay. So these two expanders that you see here are both MARPEs, but only one is an MSE. The one that is attached just to the palate, not anchored onto the teeth, that is an acrylic TAD-borne, which is micro implant assisted expander, okay? But it's not an MSE. MSE was patented by Dr. Juan Moon, and it's a very unique design. There's 4 TADs that go in the dead center, and there are arms that reach out of it, and it's attached to the teeth. So it's a very unique design. But that being said, both are MARPEs, which are micro implant assisted rapid palatal expansion. What are other types of expanders? So before MARPE, we used to think that everything had to be a surgical case. So there's a little bit of debate right now. Is MARPE, is MSE considered surgery? So I don't believe that it is surgery because it doesn't involve a surgical cut. So the traditional surgical assisted rapid palatal expanders are what we call SARPE, surgically assisted rapid palatal expanders, and that involves 3 cuts. You have the cut in the dead center, which is the anterior nasal spine. You have the Le Fort, which is, it goes sideways like this, lateral. And then you have the pterygoid cut, which is back here. Now, the most dangerous cut is this cut because they're all the blood vessels here. So more and more orthodontists and dentists are trying to get away from all these cuts, and that's why I feel that MARPE is not surgery. You're not doing those cuts. So if you want to know if your doctor is doing a surgery or not, just say, are you doing the surgical cuts? So there's a couple new, they're kind of getting reinvented now, because what's happened is we're trying to do less amount of cuts. So the traditional cuts are 3 cuts, middle, lateral, and then the back one. We're trying to modify that into less cuts, hence the birth of DOME, distraction, osteogenesis, rapid palatal expansion. But I think it's called distraction, osteogenesis, maxillary expansion. So hence DOME. That involves 2 cuts. 1 cut right here, anterior nasal spine, and the Le Fort. None of the pterygoid. The latest thing is EASE. Okay, so EASE, it's endoscopic assisted surgical expansion. It's a lot of acronyms. But this one, they actually go through the nose to the posterior nasal spine and do a split there. They don't do this cut, but they do this cut. So what you'll see is with the EASE, they go here and here. So I hope that explains all the different expansion options that you can choose from. Thank you.